Zero.
Good morning and a very warm welcome on behalf of the Achieve Coalition to this online conference on setting the course for hepatitis elimination, what the EU can do to help reach the WHO 2030 goal. My name is Jackie Davis. I'll be your moderator this morning. And on World Hepatitis Day 2021, the European Centre for Disease Prevention and Control warned that the WHO target to eliminate viral hepatitis B and C as a public health threat by 2030 would not be reached without urgent action to tackle gaps in prevention, diagnosis, and treatment. So, what can and should be done to put viral hepatitis elimination on track? And in particular, how can EU policy initiatives and funding help member states to achieve this goal? That's what we'll be discussing in today's session. If you have any questions for our panels, we have a couple of introductory keynote speeches to provide some context for our discussion, and then panels afterwards to delve into these issues in a lot of detail. If you have any questions during the panels, please use the chat function and please be as brief as possible so I can see what you want to know and who your question is for, and please say who you are and what your organization is. If you want to tweet out about what you are hearing at this event, and please do, we do want to get that hepatitis elimination message out, please use the hashtag #EndHep. It's now my pleasure to give the floor to Luis Mendao, Achieve co-chair and from the European AIDS Treatment Group, to open proceedings more formally and say some words of welcome. Luis, over to you, and thank you very much for having us today.
Thank you, Jackie, and thank you to all the participants on this event. I would like to welcome to this webinar hosted by Achieve all of you. My name is Luis Mendão. I'm someone who did live with hepatitis C for around 35 years and also co-infected with HIV. I'm currently one of the co-chairs of the Achieve Coalition, and the Achieve Coalition, it brings together patients, community actors, clinicians, and researchers, and we want to mobilize European policymakers towards elimination of viral hepatitis throughout the European Union and the neighboring. In line, of course, with the WHO goals that all these countries did endorse. And also, quite important, and the European Union has shown the way with the communication and action plan and the strategy to achieve inside the European Union the sustainable development goals. Eliminating these virus B and C, and I would add D, that parasites, hepatitis B carriers, is important for them, for their families, for their friends, but also very important to reduce the burden on the health system of increasing number of cirrhosis, liver cancer, and death. Hepatitis patients many of them vulnerable groups, have suffered as a result of these horrendous pandemic that we did face of COVID-19, that put on hold much needed care and programs to prevent, to diagnose, and to link to care patients, not only, of course, of viral hepatitis, but we are here to discuss the elimination of viral hepatitis. We must take action now. As Jackie said, the evaluation of WHO and the CDC is that we are not on track for the goals that we committed to eliminate as a public health important problem, the viral hepatitis. This is why we have this event today, to discuss how we can turn the wheel around the EU policy initiatives and funding to help member states to go towards elimination and facilitate the exchange and rollout of good practices. This is a very important point. I'm also grateful by the presence of the experts from the European institutions and stakeholder representatives, including the panelists, who can provide examples of good practices to assist in achieving the WHO 2030 goal. I'm also grateful to two high-level speakers from the World Hepatitis Organization and the European Commission, Dr. Siddhartha Datta and my old friend, I can say, John Ryan, that have agreed to deliver the opening remarks of our event, setting the scene for the discussion. Let us recall that in 2004, and I was there, the World Health Organization and the European Commission collaborated to adopt the Dublin Declaration on HIV/AIDS, which has had a great importance to push the fight against HIV and in the right direction. I think that we would need a Dublin Declaration on viral hepatitis, TB, HIV, STIs, addiction, and probably also mental health on the very vulnerable groups. We now hope that such a strong collaboration between the EU and the WHO Europe will also be possible for the benefit of the elimination of viral hepatitis and other important communicable diseases. It is only 9 years to go, now almost 8. Commission President von der Leyen mentioned only last week that it was thanks to the European researchers that the hepatitis C virus was discovered. Let us know and ensure that Europe also leads on the elimination of viral hepatitis B and C. We sincerely hope that the discussion today will create insight to help to reach the WHO goal and makes hepatitis history by 2030. People living with viral hepatitis should not and cannot wait. Thank you.
Thank you very much indeed, Luis. And as you say, that urgent need to take action, we will discuss how to ensure that we move the needle, move on, and to ensure that Europe does indeed play that leadership role that you've underlined is so important. Thank you very much for that. Now, as I mentioned earlier, to provide some context for the discussions that will follow, I'm delighted to welcome two speakers. We talked, Luis talked there about WHO and EU collaboration. Delighted to welcome Dr. Siddhartha Datta, Acting Director of Communicable Diseases in the Country Health Programme Division at WHO Regional Office for Europe, and John Ryan, Deputy Director of Public Health Directorate in the Directorate General for Health and Food Safety, better known to most of us in Brussels as DG Santé in the European Commission. A very warm welcome to both of you. Let me turn to Dr. Datta first for your thoughts on where we are and where we're headed. Dr. Datta.
Thank you so much, Jackie, and I hope you hear me well. A very warm good morning and good afternoon to everybody, and greetings from Copenhagen. At the outset, I would really like to thank Achieve Coalition for this invitation, and it's indeed a great opportunity for WHO European region to share this virtual platform with other colleagues and various stakeholders. In 2019, just few numbers, WHO estimated that there were 14 million people living with chronic hepatitis B and about 12 million infected with hepatitis C virus in the WHO European region. 2/3 of them are in the Eastern European and Central Asia region. In 2016, the member states of the WHO European region endorsed the first ever regional action plan, setting the goal for elimination of viral hepatitis as a public health threat. That plan was developed through a wide-scale consultative process with valuable inputs from the member states, the regional partners, the affected communities, including the patient group. As that plan is coming to an end in 2021, we feel it's an opportune moment to just reflect back about the gains that we have made together in this process. We have seen encouraging stories from champion countries on their innovations, especially around hepatitis C treatment, the political commitment that our member states have shown on hepatitis elimination has increased across the region, and many countries have developed the national plans for viral hepatitis, some specifically adopting the goal of elimination. We have also seen remarkable progress in reducing the number of hepatitis B infections in many countries across the European region, largely thanks to the hepatitis B childhood immunization program. We can all agree hepatitis B vaccination has become a public health success story. In 2019, the WHO European region established a process of validation of the achievement of the hepatitis B control through vaccination. Glad to share that in 2020, Italy and Netherlands were already validated. More of our member states are expected to be validated in near future. Thanks to the improved injection and blood safety, hepatitis C infections are not as common as it was, although it still affects the vulnerable population, and that in many countries lack sufficient prevention services, such as people who inject drugs, people in prisons, and migrants. There has been a rapid increase in the access to treatment coverage for hepatitis C, with most countries adopting WHO's recommended treat all approach and all for hepatitis B. We have estimated that more than 250,000 people per year were cured in the region from 2017 to 2020. During these years, partnership has been a hallmark. A lot of work has been done together with our colleagues in the European CDC and the European Monitoring Center for Drugs and Drug Addiction to improve primarily countries' capacity to monitor the progress towards elimination. However, as we have outlined these trends, there are several challenges that we should not forget about. Only a few countries in the region met the 50% target for people living with hepatitis B and C being diagnosed and that they are aware of their condition. A lot needs to be done in these areas. Some countries still have not prioritized funding of hepatitis response. More political commitment would be needed. While access to medicine has largely improved in the WHO European region, treatment scale-up is slowed down by the insufficient case finding and sometimes unnecessarily complex patient pathways, lack of decentralization and simplification of hepatitis care at the subnational level. Countries can do more in scaling up evidence-based health intervention to key population groups and people from vulnerable groups for harm reduction, addressing the structural barriers, stigma, and discrimination. Countries in our region are still facing challenges in collecting and reporting data on cascade of care for chronic hepatitis, more precisely, mortality and burden estimation. WHO strongly feels that we need to make policies based on hardcore data, and our policies should be backed up with evidence. Well, we heard from Luis about the COVID-19, and I think indeed it has been extremely challenging for the past couple of years, or at least going into 20 months, as we say, but we also see there are opportunities. COVID-19 pandemic has reversed some of the gains and added challenges to ensure viral hepatitis response in our countries remain a priority, while the country is also challenged to address other communicable diseases such as HIV, TB, and also sexually transmitted infections. We have seen there has been huge disruption in service provision and marked dip in the new diagnosis. An evidence review of the impact of COVID-19 on hepatitis services shows testing levels significantly decreased in almost all countries during the pandemic. Some analysis suggests that the treatment initiation of hepatitis C may have decreased by almost 50% in 2020 compared to 2019. The service delivery innovations that has come along with COVID-19, plus also the COVID-19 induced digital health revolution, are the vivid opportunities that the countries and the member states and the partners around today need to reap the benefit from. We recognize the urgency that the countries need to put hepatitis elimination as a target and to achieve the Sustainable Development Goal by 2030. WHO will build on the progress that we have seen in our region for the past years and advance strategies and policies to improve access to health services, address stigma and discrimination, achieve equity, support human rights, strengthen public health, and ensure that the voices of those affected are central to our efforts. So what is that we wish to look forward? Currently, WHO Europe is in the process of developing its first integrated European regional action plan for HIV, viral hepatitis, and sexually transmitted infections 2022-2030. Better meaningful integration of the responses to all these three diseases calls for a fundamental shift towards person-centered health services that reaches key populations with overlapping HIV, viral hepatitis, and STI concerns. WHO Europe will be conducting consultations in January and February next year, and we request and invite our member states, partners, civil societies to use this opportunity to engage and contribute to the development of this regional action plan. Let me give you some
very briefly now, if you would, Dr. Datta. We are running over time, sorry.
Okay, that's fine. Thank you, Jackie. And the last point would be that we ensure that this integrated regional plan will be a prudent platform to mobilize an adequate political support and provide the impetus toward the strategic partnership with the European Commission and other stakeholders. We look forward to working with Coalition and others. Thank you so much, Jackie, for this.
Thank you so much, Dr. Datta, and very good to hear that integrated plan is being developed and that collaboration between you and the European Union with the Commission, which Luis was underlining, is so important. Thank you so much for being with us. As you say, a public health success story, but many, many challenges that remain that you outlined for us so eloquently. Thank you very much. Lots to discuss and delve into. Now delighted to give the floor to John Ryan, who, as of last week, Director of Public Health and Deputy Director General at DG Sante. John, great to have you with us. Over to you.
Thank you very much, Jackie. It's a great pleasure to be here this morning and also to speak with such distinguished colleagues and friends. The Commission has pledged its commitment to help member states to reduce hepatitis by 2030 as part of a wider sustainable development agenda. And the issue is really how can we act on this infection, both through prevention and through treatment. Now, we know that vaccines can prevent hepatitis A and B, and therefore I'm very pleased that most EU countries have universal vaccination programs in place for vaccination B. Yet we should strive to further increase the vaccination coverage, for example, by stepping up the implementation of actions called for in the Europe Beating Cancer Plan and in the Council, the European Council of Ministers recommendation on vaccines. And we're actively pushing both of those plans at the moment from our side. The Council recommendation on vaccination is currently underpinning our general work on vaccination, takes a life course approach to the issue of vaccination. On the international level, I'd just like to mention as well that Team Europe, which is the Commission and the Member States together, have been supporting Gavi, the Vaccine Alliance, with about 284 million euros since its inception, and we have pledged a further 300 million for the period 2021 to 2025. Gavi helped immunize more than 822 million children in low-income countries, most of whom received the pentavalent vaccine, including hepatitis B. Another 300 million children are to be immunized in the period 2021-2025. So it's not only at the European Union level, but also through our development systems and outreach, we're also focusing on hepatitis. As for other preventable diseases, testing and early diagnosis are extremely important, and therefore we must expand our prevention and testing programs to reach out to those most at risk and to cure those in need living with hepatitis C. In particular, the integration of prevention, treatment and care of hepatitis and its co-infections should become a standard practice. The Commission has been investing in outreach activities focusing on vulnerable groups and improving access to integrated testing and care. Results from the EU initiatives could be transposed at national level. In the field of chronic non-communicable diseases, we identified best practices or best interventions, and the member states in our steering group on prevention and promotion select these interventions from a menu and then choose the ones which they wish to upscale. We encourage the sharing and we support these exchanges of best practices, and also adapt them to national circumstances. Of course, these projects are then financed through the health programs. So there's a whole process here of selection and then rolling out of best practices of interest to the member states. I just wanted to flag to you that we're in the process at the moment of expanding the nature of this process to cover communicable diseases as well. So in other words, policy areas such as hepatitis elimination could in the future also be part of this process, where we would be focusing on the ground interventions with interested member states and NGO groups in order to fight for a common objective. So this is quite a significant development from our side. Supporting member states to tackle hepatitis B and C will at the same time help reduce the incidence of liver cancer. And of course, the Europe Beating Cancer Plan is a flagship initiative which contributes to the WHO elimination targets. The plan is one of the major Commission priorities in health and will ensure, we hope, a major impact on cancer prevention, on early detection, on treatment and care and quality of life for cancer patients and survivors. Prevention of liver cancer relies on the pre-causes, with incidence rates of hepatic carcinoma reflecting greater rates of predisposition for chronic liver diseases, with rates increasing due to chronic hepatitis C virus infection. For instance, the Beating Cancer Plan helps member states to detect people living with viral hepatitis B and C through regular testing and improved access to treatment, which will prevent cancers in the long run. Now, as we heard from our colleague from WHO, surveillance is a challenge. Data gaps make it difficult to gauge the breadth of work of the silent hepatitis epidemic, as it's called. The European Centre for Disease Prevention and Control, working with the European Drugs Agency in Lisbon, has established a monitoring system to support countries in measuring their progress towards elimination targets. The first report represents a significant step towards understanding the priority areas for action and helps to identify gaps in prevention and control strategies. But the whole issue of data is an area for improvement, and we hope that our digital health policy will play a role there as well. While the COVID pandemic has brought the importance of health into the limelight, it also reduces access to all sorts of health services, including for hepatitis. And we can draw lessons from this for hepatitis prevention measures. From the side of the European Commission, we took first steps already last year. We have proposed a strong legislative package, which is being discussed in the European Council and Parliament at the moment, in order to strengthen our tools to deal with cross-border health threats. Also, the ECDC mandate and the mandate of the European Medicines Agency are being strengthened. And I just mentioned as well, perhaps, Jackie, the financial instruments. We have the EU for Health programme, which has a vastly increased budget, and the Horizon Europe programme, which also has a very strong health component. And both of these could continue to be used, of course, for different aspects of hepatitis prevention and control. We hope that this year, for example, 5 million euros will be dedicated for action grants to support the implementation of best practices for viral hepatitis, TB and HIV/AIDS, and other sexually transmitted infections. So we're already starting in the first year of the program to spend the money in priority areas. And last point, Jackie, is the issue of the pharmaceutical strategy, where the Commission emphasised the importance of patient-centred care, a point made by my colleague from WHO. And there will be new legislative proposals in the area of the pharmaceutical policy, which we hope will go in this direction. And finally, we invite all of you to participate actively in our health policy platform, which allows any stakeholder in health with an interest in health to give us their views and to discuss with the Commission and other stakeholders on what Europe should be doing. So best of luck with this conference. It's a very interesting topic, lots of familiar faces, and good luck with the remainder of the
Thank you so much, John. Thank you for being with us. Thank you for making the time. And you're talking there about some of those challenges that remain and how EU instruments, financial instruments and other tools can help. We're going to be discussing later on how to use them to deliver maximum impact. But thank you so much. Lots to discuss, and we will report back to you later on. We are going to move in a moment to discuss the barriers that we need to overcome to drive forward elimination. But before we do that, we wanted to show you a short video, a testimonial from a former hepatitis patient. So let's watch that video.
Me llamo Luisa Togalina, tengo 69 años y soy trasplantada de hígado. Fui al médico por un dolor de espalda y entonces el doctor me dijo que me haría unos análisis. Con el resultado de los análisis vieron que tenía las transaminasas muy altas y entonces me dijo que podía ser una hepatitis. A pesar de encontrarme yo muy bien, una cirrosis y un hepatocarcinoma, y la solución era un trasplante. La vida cambia por completo, los sentimientos, las sensaciones son muy fuertes. Valoras el hecho de cada mañana, de levantarte, ver salir el sol, las hojas, los árboles. Todo es diferente, es más grande.
So, ladies and gentlemen, we want to really focus and dive in now on those barriers, on what the challenges are. We've heard about the progress, but what are the barriers to improving that progress, to making sure that we get back on track to deliver the 2030 elimination target? I am delighted to welcome Alexis Gustil, who is Director at the European Monitoring Centre for Drug Addiction, Professor Thomas Berg, Secretary General of the European Association for the Study of the Liver and Head of the Division of Hepatology at Leipzig University Medical Center, and Ivana Dragojevic, Patient Advocate, Achieve Co-Chair and a Board Member at the European Liver Patients Association. So let's dive straight in. And Alexis, we've heard from our opening speakers about the impact of COVID. We've heard, yes, that it has been a setback, but also it has opened up opportunities. What is your assessment of the impact it has had, and whether this presents new barriers or the same barriers, if you like, augmented? Alexis first, same question to you all.
Thank you very much, Jackie, and good morning. Good morning, everybody, and congratulations to Achieve and WHO. Thank you for the invitation. I want also to congratulate my colleague and friend John Ryan, because yesterday there was an agreement reached on the new regulation for ECDC that will give more possibilities to the agency to fulfill its mandate. And my congratulations to Andrea Amon. Yes, Jackie, life has been difficult for everybody with COVID. And I would say especially for people who are using drugs, but also for people who are working in treatment programs and in harm reduction. So certainly there has been a major negative impact as far as the elimination goal is concerned, starting with the fact that in most of the EU member states, if not in all of them, services programs to people using drugs were not considered as essential and were closed. So certainly there is a big challenge there. There is another challenge, it's also due to the fact that I think the vision in most of the countries or in most of the services is still a bit too vertical and specialized, with some interesting innovations. For instance, Professor Rui Tato Marinho here in the hospital, in one of the big hospitals in Lisbon, he decided to send his medication. I think we should really push towards different cooperation between different services because the referral for the last 25 years is still a major obstacle. And then certainly we will come back to this, but I still would like to say that the COVID pandemic also was the opportunity some very new innovative ideas and initiatives, and also in some places, not always, unfortunately, the room for new partnerships with the clients of the services, which I think is certainly one of the keys for a better and more positive outcome in the future.
Thank you very much. Lots to come back to in a moment. And that point about the verticality, the specialization, and how to create more integrated care, something I hope we can discuss in more detail. But Thomas Berg, Professor Berg, from your perspective, as we've heard now from a number of people, that impact of COVID, do you believe the impact has created new challenges? Does it require a fundamental rethink, or is it a case really of doing more of what we were doing before and doing it better?
Yeah, well, I think, we have done with the help of the Policy and Public Health Committee in EASL, we have done a survey during 2020, during the waves and the pandemic, in European centers being specialized for hepatitis care. And it was clear that, the numbers of tests being performed, the number of consultations, the number of treatment started was reduced. So it was clear that it impacted, as for many other diseases, also impacted the management of patients with hepatitis B and C. But on the other hand, and I really agree with Alexis, I think it gives opportunity what we have learned in terms of viral infections, and also our policymakers learned a lot how to prevent viral infections. And of course, viral hepatitis B and C are not so easily transmitted, but in certain at-risk populations, it can be spread quite effectively, as we know the situation in prison or among people using drugs. And I think here we can really learn from what has been achieved and what measures have been taken in order to stop the pandemic with Corona. And I think this can be easily also implemented to help to get rid of viral hepatitis in our world.
So the key question will be, how do we make sure that we do seize those opportunities, that we make the most of what we have learned? We'll come back to that in a moment. But Ivana, you're working on the ground, you're providing counselling services to hepatitis patients. What has the situation been, your on the ground experience for you and members in other countries of the impact of COVID? And how do you see the challenge ahead now?
Yes, thank you, Jackie. Thank you to everyone. So 90% of the resources of the health system in the world is put into fight against COVID-19. So the screening, prevention, and treatment for the viral hepatitis were in question even before the COVID crisis. So in this moment, it's really, let's say, challenging. But most important thing is that trust in the health system care has been staggered. People have been afraid to go to the checkups, and prevention is almost eliminated from to-do lists. So we need to change many things. So we have examples of a good practice, but we need to have somebody to facilitate that. So continued and increased EU for health funding in the years to come is essential, if you ask me. So the establishment of EU-funded transnational networks to share best practice, including scaling up diagnosis and linkage to care, everything is very, very important. But hepatitis is still perceived in public as a disease that affects only risk groups, although statistics say otherwise. In order to change public opinion, access to information needs to be improved. So we need to be aware that liver cancer is the endpoint of untreated hepatitis, and that liver cancer is the second most common cause of cancer deaths. So while cancer prevention remains mainly focused on lifestyles, such as diet, fitness, smoking, etc., so we need to send message to public that viral hepatitis is preventable risk factor for cancer. Thank you, Jackie.
Thank you very much indeed, Ivana. And Alexis, just coming back, we heard Luis made mention at the beginning, and it's also been referred to by our opening speakers, of the Dublin Declaration on HIV/AIDS in 2004, and how important that was to inject more impetus, to move us, push us in the right direction. Do you believe there is adequate recognition of hepatitis as a public health threat? And how do you see the way it is regarded as compared with other diseases? Not wanting to get into a competition between them, but how do you see its place in terms of recognizing how important this WHO goal is?
Well, Jackie, you raised a very important and very challenging question, which is, you mentioned the word competition. I think in the decision-making process, a succession of priorities, and as Ivana said, and I fully agree, for the moment, everything is about COVID or cancer and nothing else.
Yeah.
Just in the EU for Health program of the Commission, there is no mention of drugs. So I understand that we need to focus the policies and the actions to try to have an impact. Fully support. I, of course, fully support the fact that we cannot cover everything, and we need to see where we can really manage to make a difference. But the problem is, even in the program of Achieve that are received for the conference, there was the mention of ECDC, there was the mention of the infectious diseases, but we don't mention drugs. And I think it's not about Achieve or ECDC or the program. It's about the fact that we are extremely also under the pressure of the needs and the situation. What we are lacking today, I think, more than ever, is inclusive and comprehensive policies. If I look at what we have learned from professionals from the field, through all the actions and initiatives we have launched during the COVID pandemic and the webinars, in many cases, they say, okay, we managed to provide some care to people using drugs, to do some prevention, to give a shelter to some homeless. But it was not only thanks to the drug programs, especially some of them were closed. It was thanks to the fact that there were other health and social programs. So I think for the moment, policies and programs, for the sake of efficiency, are, I think, too frequently so specific and specialized that it's like a French humorist was talking left hand. So if you have a cancer to the right hand, you are not eligible to the program. I think it's a bit one of the challenges. If you speak to decision makers about the Millennium Goals, the Dublin Declaration, there are other declarations from Dublin, by the way, including on drugs or programs. So sometimes there is a confusion in people, and they need to make choices. And what is true is that COVID has boosted a comeback to give more importance to public health, but given the pressure of the emergency of the situation, nothing else is existing. And I can tell you that the biggest fear from people working on the field of drugs is that they will pay the bill of the COVID pandemic the day the budgets will have to be cut at national level to cope with the huge increase in the public debt that was incurred by the member state to face the pandemic. So that's a concrete
Thank
challenge.
you, Alex. Thank you. Thomas, would you agree with that? Is that how you see the picture and this real concern of those who will drop off the radar or have dropped off the radar and are not getting the attention they deserve? And I'd link this to the comment about both hepatitis B and C being preventable cancer risk factors. Ivana mentioned that as well. Whether there's enough attention paid to this when you look at the Beating Cancer Plan and other EU initiatives, is there enough, do you think? Because I think it was Alexis said everything's been about COVID and cancer. Well, we're talking about cancer here as well. So if it is about cancer, why aren't we paying more attention? What's your assessment of that?
Yeah, so we really hope that liver cancer will be among priorities in the EU for Beating Cancer Plan. And we also, together with EASL, we are really, in a way, fighting for that, really telling policymakers that liver disease in general, but viral hepatitis in particular, are really main risk factors for liver cancer, and they can be easily prevented. Well, of course, there is a stigma around liver disease and the liver per se, not so easy to understand why, but this is something we have to be really aware. And I think it's not only to fight against the stigma related to viral hepatitis, but to liver diseases in general that will really help to improve the situation for patients being affected with viral hepatitis. And perhaps you are aware that 2 days or last week, we launched the EASL Lancet Commission on liver disease burden in Europe and what action need to be taken in order to prevent it, and that we need a shift towards more prevention instead of dealing with the end-stage disease. And we were very happy and grateful that the president of the EU Commission, Dr. Ursula von der Leyen, sent a video message really highlighting the importance of liver disease. So I think there is movement and of course a lot to do, but we have to tell the right, you know what I mean, stories, you know, really showing what can be done, what the liver is such a wonderful organ, you know, it's not only affected by diseases, it do all the metabolism. And this is, I think, also a story we have to tell, a very good narrative really for the community, because, you know, we have viral hepatitis, but we have also the fatty liver disease pandemic and all these things that will turn into liver cancer in the next 20 years.
Thank you very much. Ivana, just picking up on that point about stigma and your experience and the experience of the people that you counsel and work with. How bad is it? How bad is the stigma? How bad is the resulting discrimination right now?
It's a tough question. You know, it is human nature to want to stand out in society and not be labeled as a member of, let's say, risk group. If there is a risk that you may lose your job or emotional partner, or that you will be banned from seeing family members, let's say, fear is the dominant feeling you have. When you find out that you have hepatitis, you only think about those things. So that fear is the reason why a large number of patients are hiding and do not have the strength to fight for their rights. So, maybe I have a question for all of us. So do we know how many public figures or celebrities who have agreed to be the face of the hepatitis campaigns? Not so many.
Yeah, and you need those people. You need those public figures, ambassadors, if you like, for the issue. And just to your point about why a large number of patients are hiding, comment more from our audience, but question as well. Dear panelists, what does it mean to, quote, do more and do better to eliminate hepatitis? This person in the audience says we need to share best practices and introducing mandatory testing for people over 35 years old, as was done in Germany, to detect and treat people faster. We're going to hear about the German example in our next panel. But is that sort of thing the sort of thing we need to be doing to overcome the barriers? You make it a mandatory part of health checks, and therefore, if you like, you overcome this fear because it becomes much more of a routine thing to do. Thomas, do you think that's part of the solution?
Yeah, I think it's certainly part of the solution. I think there are two dimensions, you know, and again, you can compare it a bit about the COVID situation. You have situations where you have a huge amount of spreading and a very vulnerable population, and perhaps it's wise to target this situation. So we know, and you mentioned the situation in prisons, where many people get infected, you know, they enter the prison without infection. So here it's so easy to screen, and you will find many patients that then can be also treated. And we have the situation, of course, among people injecting drugs. And here we have on-site tests, you know, all what we have done with street workers. So you can, with low-level things, you can really help here. So this is the one dimension, and we called it the micro elimination, yeah, in certain fields and groups. But the second thing is really to find the hidden burden in our broader community, and this is more difficult. And I agree. I think without a routine testing, and I'm quite grateful that we have it now in our health check that you can be tested once for hepatitis B and C. I think we need that, you know, a screening for ALT levels, and then immediately a test for viral hepatitis, and yes, of course, a test in general. I think both is needed, really. Yeah.
Thank you. And Alexis, you pointed to, on the one side, your concern that people who inject drugs are being left out. On the other side, this problem of encouraging them to come forward to get tested and so on. Is mandatory testing part of the answer, do you think, or do we need other approaches?
Thank you, Jackie. I think what we need actually is a combination of tools. I think something that is only compulsory for easy to reach has little chance to give results that the other methods don't give. I think what Luis and the colleagues from many associations and NGOs and activists have shown and clearly demonstrated is that by associating the clients to the campaigns and to the efforts, not only think about us without us, not only support, don't punish, but a real broader approach that includes the clients as partners. That's the only way to do. And actually, this is not something new. Over the last 30 years in the EU, there have been a lot of experiences showing that there are possibilities to do better and differently. Still, if you allow me to add one element, I think the challenges we see to reach the elimination goal for Hep C is not only, the difficulties are not only linked to COVID. Already before, there were no major changes in most of the countries in the last 10 years. So I would like to be clear that everything is not because of COVID, but COVID has boosted and amplified. But for instance, we see related to HIV, there are some outbreaks, for instance, in Thessaloniki, that I visited a few weeks ago. And the situation shows that what is more and more difficult is to get the support of the community. Because some of the programs like drug consumption rooms, like pill checking or support being delivered as harm reduction services to people who are using drugs, if you push for too quick action in the name of efficiency, and if you don't involve the community, instead of being successful, the rejection from the community of the program. And involving the community, I think, is one of the keys for a more successful campaign and program.
Thank you. There was one other issue I want to touch on before we try and draw some conclusions from the session and move on, and that is the question of inequalities. And I just wondered, Ivana, from your perspective and from the European Liver Patients Association, we heard our opening speakers talk about inequalities in terms of access to information, to testing and care. And I'm wondering here how you see the differences across the European Union and what we can do more to ensure that we learn from those who are doing best at this at the moment. There was a warning from John about tailor-made approaches and national circumstances, but how do we address this question of inequality? Same question to you all.
Of course, there are differences from countries to countries, so that's alive. Many member states lack significant national funding for hepatitis, so we need to change that, but maybe the answer is, let's say, a EU-funded transnational network to share best practice, including increasing diagnosis and linkage to care and improve data collection. That can help significantly.
Thank you very much. A thought on this, Alexis. I mean, you talked earlier about cooperation between different services, integrated care. Is that what we see in the countries, in the member states that are doing best? And how do we address this inequality? I mean, yes, Ivana says it's inevitable, but what can we do to narrow the gap?
Well, to narrow the gap, I agree with what Ivana said. What I can add is to raise awareness, and a part of what we are doing is we have built in consultation in cooperation with the CDC that has been tested and implemented in 3 countries. Certainly the cooperation with all actors, like the association the associations that are present here in the meeting today. Also at local level, I think Unite and other organizations with local policymakers or national level policymakers can play a role. And I think, again, what we try to do is to invite, for instance, through webinars, to invite the local actors who have successful or interesting best practice to share it themselves with our audience and to explain what they've been doing. Of course, there are differences even between the member states in terms of policies, in terms of means and resources, and also in terms of priorities. I think there is overall in the contribution from the MCDDA, we have a few new studies in the pipeline that will help us to raise the awareness, but really to have sometimes a competing agenda for decision makers. So many urgent things to decide is making their life clearly even more difficult.
Absolutely.
But I think my priority, if I have one
hang on, I'm going to come back to that in a moment. Hold on,
Okay.
Hold on 1 second. I just want to get Thomas's perspective first in terms of how you talked about seizing the opportunities that have arisen from COVID. How do we do that? And how do we ensure that we really do learn from those member states who are doing best at this at the moment and apply those lessons to tackle inequalities?
Well, perhaps I can start with the inequalities. And I think, the first and really the major and most important step is really have a goal. And I think the WHO and all the people now defining what we want to achieve really helps you to see whether there are really inequalities and to what extent these inequalities in care and management translate in not fulfilling or fulfilling the goal. And then I fully agree with Alexis. I think then with the help of the European Commission and with the national governments, you need a structure with your experts in the country, then depending on the certain situation you have to find the best way. And you think we can really learn from Egypt, how they tackled the immense burden of viral hepatitis, especially C, what they done with the help of the government. And of course, it was a lot of discussion. They need some years to really establish this elimination program, but now they are really ahead, leading the world in terms of hepatitis elimination.
So it's not just about sharing best practice across the European Union. We need to look wider to who's getting it right and learn from that as well. We are almost out of time in this session, but I want to put each of you on the spot. And I stopped Alexis a moment ago because he anticipated what I wanted to ask you, which is, as we look forward, and we have heard the WHO is developing this integrated European action plan. We heard about those various commission programs, policies, financial instruments. We're going to discuss those in more detail in our final panel. But for each of you, and I'd like to start with Ivana, then to Thomas, and then to Alexis. If you had to identify a key, maybe not fair to say a priority for action, because you're all talking about an integrated approach, but a key next step. What's the most urgent thing we need to do in order to get back on track post-COVID and ensure we reach that 2030 target? Ivana, what is your key priority? 1 minute each, if you would.
I will put two, and maybe we can think of one. so continued and increased EU for health funding. So that's for sure, and SG extension into communicable diseases. So that's the one.
And if there was, and the second one, sorry, the second part.
That's my answer. So that's two things, and you can speak about it as one. So
absolutely, indeed you can. So, and we'll come back to that issue of the EU funding later on. Thank you, Thomas. Your key priority, or two, as long as you can squeeze them into 1 minute.
I can, of course. Thanks, Jackie. So first of all, it's really the micro elimination. So to stop the current burden of new infection, which is still high in many countries. That's the first. And to implement these easy to access to everything, this is the first one. And then the second one is really a kind of a screening of the population, the hidden burden in the overall population as a next step.
Thank you very much, Alexis.
Yeah, I will use one famous expression used in the different contexts, but short is always better. Mind the gap.
And which gap will you most be minding?
Well, all of them. The gap between the different practitioners, the gap between the services and the clients and the customers, and the gap between sometimes policymakers, reality, and the public opinion.
And on that note, thank you so much to all three of you for sharing your experiences, your insights, and your advice on the way forward. I'm going to come back on the points that you have raised with both our panels that follow, but thank you very much for a great discussion. So we are going to move on. We've been talking a lot about sharing best practices and learning from each other. We are going to move on to hear some best practices and discuss what we can learn from them in just a moment. But before we do that, we also heard from Alexis about people who inject drugs and his concerns about them falling through the gaps, talking about his minding the gap. So before we do that, we're going to watch another short video, this time a testimonial from someone working on the ground in a Belgian NGO clinic for people who use or inject drugs. So let's watch that video.
I'm Tessa, and I work at the free clinic, but I'm responsible for the GIG, and the GIG is standing for Health Promotion in Injecting Drug Use Founders, and it's a combination of needle exchange and the Hepatitis C project. But I assure you, we are going to try, and we are going to keep on fighting. And I think we need a lot more harm reduction to reach that goal. So keep harm reduction on the agenda, keep working with Hepatitis C on the agenda, keep looking for fundings. We need partners, we need to connect with different organizations, different specialists. We have to work with people with lived experience. We have to reach out as much as possible. We need to prevent, we need to sensitize, we need to do a lot.
So let us hear more about some of the good practices that are happening in response to viral hepatitis across Europe and some of the barriers and challenges that people on the ground face and how EU policies and instruments can help them. I'm delighted to welcome Maria Georgescu, Executive Director of the Romanian Anti-SIDA Association, ARAS. Very good to have you with us, Maria. We also have Dr. Sandrine François and Céline Rigaud from the Centre Hospitalier Universitaire de Limoges. Great to have you both with us. And Professor Marcus Kornberg, Deputy Director of Clinic for Gastroenterology, Hepatology and Endocrinology at Hanover Medical School. So before we pick up on some of the points that have been made by our opening speakers and in our first panel, I just wanted to ask you to tell us a little bit more, and perhaps I could start with you, Maria, and then move to Sandrine, and then on to Marcus. Tell us a little bit, if you would, briefly about the work of your organization, what you're doing, the initiatives that you have launched in response to the challenges we've been discussing. Maria.
Good day. Thank you for the invitation and the opportunity to talk about us here. ARAS, Romanian Association Against AIDS, it's a member in the Coalition Plus and a non-governmental association whose main objective is to prevent HIV, hepatitis B, C, TB among vulnerable people. We provide outreach through a mobile unit, a drop-in service for people who inject drugs, for sex workers, for men who have sex with men. We have 2 opioid substitution treatment centers and a checkpoint for men who have sex with men. We are among the few harm reduction service providers in Romania, for some services even the only service provider, implementing services with very limited resources. Our services cover 20% of the from the needs. People who inject drugs in Romania face many barriers in accessing hepatitis C prevention, care and treatment services, and one of the shortcomings being the national investments to ensure hepatitis C screening and connect this population to treatment. ARAS initiated the pilot project in 2019, aiming to the hepatitis C microelimination among 1,000 people who inject drugs by providing an effective model for educating them and increasing their access to the treatment. Our partner in this project in the medical field were the National Institute of Infectious Disease from Bucharest, its genetic laboratory, and the Bucharest University Emergency Hospital. I will talk a little bit about this project because it's an example of what we are doing in the hepatitis field. It was 3 levels of implementation of our project. The first one, it was an intervention consisted in the improvement of the hepatitis B and C prevention among people who inject drugs. This being an activity that ARAS has carried out for years for its key populations. The second level involved rapid hepatitis B and C testing and counseling in our ARAS services. And 210 people being identified reactive for hepatitis C. And in the last level, we connected these people with the hepatitis C treatment services. We hired 2 patient navigators to guide these people through the health system and facilitating the linkage to hepatitis C treatment. And in this project, we faced organizational and very bureaucratic barriers of the Romanian health system, which delayed the entry in the treatment by 5 months. Then the COVID pandemic began and the access to the hospitals for non-emergency reasons or non-COVID was stopped, especially in the infectious disease hospitals. Difficult access to medical services and connection to treatment with doctors from the infectious disease hospital with whom we usually collaborate in ARAS, lead us to collaborate with the University Emergency Hospital, Bucharest. And in this activity with 2 hospitals, in this partnership with these 2 hospitals, more than a third of people undertaking hepatitis C genotype screening. And as the genotype screening was not covered by the National Insurance House, it should have been covered by the patient at cost of €100.
Yeah.
And this cost discourages, especially people from vulnerable groups, to access these services, and therefore their entry into the treatment. So these costs have been covered by ARAS. As the final
Very
result,
briefly now, if you would, Maria.
I will finish immediately. 50 people from this 1,000 initiated and completed the interferon-free treatment for hepatitis C in the context of this project. It is important to mention that the panogenotype treatment was not available in that time in Romania. What I want to conclude is the diagnosis of hepatitis C remains particularly difficult for IDUs in Romania for many reasons, but I will mention if it's important after.
Thank you very much. We will come back on those issues. I just wanted to get a sense of the sort of work that you're doing, the wonderful work that you do, and what some of the challenges you face. Sandrine Francois, if you could tell me a little bit about the work that you are doing and how you are responding to these key challenges we've been hearing about. You are muted, Sandrine. Can you unmute yourself, please? Still muted at the moment. There we go.
Okay.
Yep. Thank you.
Okay. Thank you for the invitation. Okay. Me and my colleague are in charge to coordinate the Scanvir project. So Scanvir project was developed by Limoges medical teams, and the objective is an all-inclusive test and treat strategy to promote HCV testing among vulnerable groups in unconventional facilities. The idea was to create the event on dedicated days to optimize the efficiency of screening, the immediate initiation of treatment, and the patient retention in the care pathway. So in terms of organization, we dedicated monthly screening days to bring together in each structure the multidisciplinary staff involved, hepatologists, infectiologists, addictologists, nurses, and social network, and the screening tools for HIV, HBV, HCV rapid test, FibroScan for liver fibrosis, and point-of-care molecular testing in a joint action. The patients are recruited upstream this event by dissemination of information by transversal networks, either psychiatrists, addictologists, generalists, pharmacists, or social workers, and dedicated means of transport can be offered. If one of the tests is positive, a specialized consultation is immediately proposed on site. Risk prevention, addiction, and psychosocial management are systematically offered. From a few months, positive HIV rapid tests are immediately completed by HCV arena tests using GeneXpert technology. This allows a temporary reduction for HCV treatment. Then fewer patients are lost to follow-up. So since the end of 2017, 400 patients have been cared for. 100 patients accept the FibroScan to evaluate their liver fibrosis, and 65 accept the rapid test. We have 31% of patients were positive for HCV antibodies, and among them, 66 had a replicative profile. 80% initiated treatment, of which 62 are cured now. Still others are under treatment. Nevertheless, 20% remain untreated today because they are either lost to follow-up or homeless. We constate severe fibrosis in 14% of patients, and also HIV viremic patients had a high rate of advanced fibrosis. So, as conclusion, the Scanvir project, based on dedicated data, bringing on site a multidisciplinary team with innovative diagnostic tool, helped to increase profitability of testing and treat and cure 80% of HIV positive patients outside the world. We confirm the educational role of FibroScan, leading the collection of patients who refuse rapid tests. This model can be easily applied to other territories. And I would like to add that to illustrate this project, I invite you to watch a film produced by BBC. I think the organizer of this webinar will be post the link after.
Absolutely, and fantastic that you got that awareness from the BBC, and very much there. I mean, Alexis was calling in our previous panel for an inclusive and comprehensive approach, and you just showing there exactly how it can be done and done effectively. Want to come back on that question? You said it was easily applicable elsewhere. Come back on how to do that a little bit later. But Marcus Kornberg, complete the picture for us. We had a question you may have heard in our last session about testing for people over 35 as part of general checkups. I know that is part of what Germany has been doing. Tell us about your work in this area.
Yes, thanks, Jackie, and good morning, everyone. So among other positions, I'm also the medical executive secretary of the German Liver Foundation. And we have been fighting for many years for liver disease to be included in national screening programs for the health examinations. And finally, we were successful together with the German self-help group, Deutsche Leberhilfe, the patient advocacy group, and also for the Society Gastroenterology, Digestive and Metabolic Disease. So it was a joint effort. And finally, we could convince the Joint Federal Committee, so to speak, the politicians, that on this year, insured persons over 35 years of age will have the right to be tested once for viral disease, hepatitis B and C, as part of the so-called Health Checkup 35. So this is a general health examination. I think this is really great. It has been a long road. It was very difficult to convince them. In the end, we were successful. But at the first, part, they wanted to include only the screening for risk groups. And in the end was very challenging. And then also the family doctors stood up and say, now, should we now put the map of Central Asia on our desk and look for every patient where it's coming from? So it is very, challenging to do it for risk groups. So we need a very pragmatic way. And this was really the key to convince these organizations to implement it for everyone. Now, age of 35, that is still a limitation. I think we need it also for younger people. But at least that is really a milestone, and to bring also awareness for viral hepatitis B and C to the German public, to the family doctors. This is really important, and I think a step forward for elimination to find those who are, hidden and not recognizing their viral hepatitis. I think a milestone, and this should be done. And we should not do it for risk groups. That is made to challenge. You have always to consider and ask the people for risk factors, and then it will not be done. So we need very pragmatic solutions. Everything else does not work in my view.
Thank you very much, Marcus. And that point about awareness, and Sandrine, you talked about the education role. I wanted to just ask you, when we look at effective strategies and initiatives to support the sort of work that you are doing, could more be done? Should more be done in terms of awareness? Sandrine, in a broader sense, your project is doing this, but at the sort of policymaker level, do you think more needs to be done to really underline the risks, the importance of screening tests and so on? You're muted, Sandrine. Sorry.
Yes, concerning the test, we need to develop the tools to disseminate the information in order to bring the patient for the screening seat, and via social networks. It's very important, I think.
And Maria, I mean, we talked in the last panel about the stigma, the discrimination that still goes with all of this. How important for you is that awareness role, is educating people about hepatitis B and C? How important is that as part of any strategy to address these issues?
Yes, we have very good examples from the HIV response in our country, but not only here in the global. And we know that to educate and to inform and to educate people, you need to be near them. So we consider that the community services who are very near the people and for the most exposed people, the vulnerable population, it's very important. For that reason, the the community services like needle exchange program, opioids substitution treatment, checkpoints, outreach are very important. And also multidisciplinary approach will let people to come and to have hepatitis C and B testing, and also to be able to link them to the treatment. But very important also is that the national program in Romania, and as an example, it's a screening program for a part of Romania, half of Romania, through the family doctors. But in this medical, to the family doctors, the vulnerable population not attend these cabinets. They are very far from the medical system because they are not insured. They are not, they have afraid because it's a lot of stigma in the medical system. So I consider that these community services who are very friendly with these people will solve the problem.
So for you, that is the key. It is supporting community services like the sort of services that you're providing is the only way to get them to come forward.
Yeah, and this very, let's say, far from health system people.
Absolutely, absolutely. Marcus, for you, the key ingredients for effective strategies, we've talked about that testing and how important you believe that was and how you made the argument to get it included. But we've talked also a lot about that, what Maria was just talking about, the multidisciplinary approach, the all-inclusive approach that Sandrine and Celine and their project are following. How do you see that?
Yeah, that is crucial. I think, also with our healthcare checkup, we may not reach those vulnerable people because they don't go there. And I think we need a very strong network, and everyone needs to know that these hepatitis virus infection can be cured, or either in terms of hepatitis C and in terms of hepatitis B controlled with very effective therapies. That is the key to really put this message out. And whenever we have an infectious disease that can be cured or prevented or whatsoever, and we know this now from COVID, every day we test ourselves for COVID, self-test. And this is the key to put this out, that infectious diseases can be easily tested, and we can also establish in the future self-tests. That is discussed also for HIV. If we have the networks, we need, of course, then if someone is positive, to have the networks that those go to the right place to get the treatment and management. And this is the key to have, also incentives for the doctors to treat hepatitis B and C. It's much easier to get money for the physicians to treat whatever, cardiology.
What sort of incentives
patients.
do you think will work best, Marcus?
What works best?
Yeah,
I mean,
in terms of incentives.
Incentives that, for in Germany at least, for every patient you treat, you get a special incentive from the health insurance to treat your patient. Right. And hepatitis B and C is speaking medicine, I would say. You don't do anything, scoping or whatever, and you barely get money for this. So you have 5 minutes, the patient comes in, goes out, you have no time. And we need, I think, more incentives for the doctors also to treat chronic infectious diseases, that you spend more time and get educated for this and interested in those patients. Otherwise, they get lost, and they come in, they go out, you don't care. And this is a dilemma. And we have also doctors that take care of substituted patients. They get incentives to treat those patients with polamidone or whatsoever, but they don't get any incentives to treat hepatitis B and C, and they're not interested. They're not interested. They have the patients. Some of them, yes, in Germany, we have some doctors taking care of these patients. They do a great job, but others not. So they are not interested. They're not educated. They don't know what to do, and this is really a problem. We have enough doctors. We know this, and but we need to really have the approach that everyone who can treat those patients will do it.
Yeah, thank you. And Sandrine and Celine, for you, in terms of, I want to come to what you would like from EU policymakers in a moment, but in terms of key ingredients for effective strategies and initiatives, if you were giving other people advice, You said that what you're doing is easily replicable in other territories. If you were giving others advice on how to emulate what you have managed to achieve so far, what advice would you give them about what are the key elements of any effective initiative in this area?
I think the key element is multidisciplinary approach in the same seat and in the same time. Really, it's very important. We take time for the patient. We take time to explain the pathology, the fibrosis, etc. And we take time to propose and explain the treatment. It's essential.
Thank you. Maria, would you have advice for others who want to replicate and learn from your work about the key ingredients, what they need to do to deliver effective projects?
Yes, I can. Here in Romania, we face a lot of problems with collaboration between sectors. So it's not only multidisciplinary approach, but also intersectorial approach. So we consider the medical system our partners as a civil society, but also they need to consider us very serious and very important partners, because we are working as ARAS in these last 30 years in HIV field. And this is important. It's not only multidisciplinary, but also intersectorial. And also it's important to have a political will. So our government needs to consider this issue, hepatitis B, C, infectious disease, COVID, as the important issue, and to put the table all these sectors, not only Ministry of Health and so
thank you. And Marcus, picking up on that point about political will, it was political will, if you like, that you had to work to get for your initiative. For that, you explained how difficult it was to convince, and I can see that in member states where budgets are very tight for health services and so on, even harder to make that case. What do you think is the key for others who maybe want to go down the same road, who are fighting the same fight that you fought for so long? How can they win the argument, particularly, as I say, in member states where health budgets, all member states have stretched health budgets, but some much more than others?
So my mentor, Michael Manns, always say you have to pee in the same edge until it stinks. And you have to be rigid and keep fighting for this and to make the same argument over and over again. That is particular what we did. Don't give up. And I think now COVID is a good example that we need to do something for infectious disease, especially if those are treatable, and we can do something. If there's an infectious disease, we cannot do something, then okay, yeah, then it's a harder argument. But this is the case. But I think it's a very hard, and prevention is always a hard business. We know this from the vaccine thing. Yeah, you always do something if it's too late. Yeah, and that is really the problem, to learn something now from COVID, maybe from the COVID pandemic, that prevention is really something that is good for in the end. And we have all the modeling. If you can prevent something, you spend some money in the beginning, but you earn something later on and you benefit. And this is the key to really have your mind on the prevention. And if something can be prevented, liver cancer, liver cirrhosis, by early prevention, by testing. Testing is preventing. We know this now from COVID. Yeah, testing is preventing. It's not just the vaccine. Testing is preventing, and early treatment is preventing the outcome and the sequel of hepatitis. And this is the key. But we need also to give the money to the doctors to take care of this, and not just that you named it. Yeah, you have to explain them. You have a viral disease, you can develop cancer, and so on. That is not doable in 2 minutes. Yeah, you get money for if you do a scoping and gastroscopy, colonoscopy, and things like this. It's also prevention for colon cancer, but we need the same for speaking medicine. Yeah. That is something we need. Otherwise, we will fail.
Of course, the argument prevention saves money in the long run, because we've talked about that risk being a risk factor for cancer, for treatment. So short term, you do the right thing in the short term, you get a long-term result. I just want to ask you all, in terms of EU policies and financing. We heard from John Ryan at the beginning of today's event about some of the policy initiatives, the EU for Health programme, the pharma strategy, the extension of the mandate of the European Centre for Disease Prevention and Control. Lots of initiatives at the moment at EU level. Yes, driven by a greater focus in the COVID area, but going much beyond that. We also heard about the money under Horizon Europe, under the EU for Health programme. What do each of you want? Maria, what do you want from policymakers, particularly at EU level in this case, but also at your national level, to support your work most effectively? What can they do to help you most?
So if you ask me, I need that the EU needs to monitor how each member state implements the recommendation by facilitating multidisciplinary and cross-sectoral approach to the most exposed people, either directly by requesting reports on this topic or indirectly by conducting research among those exposed or living with hepatitis B, C in the state members. And also EU funding policies must reinforce the involvement of the civil society at the country level in the implementation of funding dedicated to the member states to design policies and accelerate progress to meet the global hepatitis targets.
Thank you very much. Sandrine and Celine, what do you want from the EU policymakers? How can they best support you?
I think increase the human resource of physicians, nurses, and social workers. It's very important. We need money for this. And like I said, we need to organize validating training on the use of screening tools in the unconventional structure.
And on that point of monitoring and measuring, how difficult do you think it is, these data gaps we've been talking about? How can we make sure that we fill them? Because people often say if you can't measure it, you can't deliver on it, you can't act against something. What do we need to do from bringing it up from the regional and national level to the EU level? What can be done, Sandrine? And do you think that's an important part of the picture that we need to build this much better data collection system? Does it?
No, it's not clear for me.
It's not an issue. It's not a major issue for you. But Marcus, when we move to the national level and to the EU level, how important is that? And what do you want from policymakers? Is it money you want? Is it other things that are more important? Is it that impetus? We talked earlier about the EU and the WHO and whether there could be more of a strategic partnership that Dr. Datta was talking about. Is it the awareness? Is it driving that political will, or is it money? Is it something very concrete?
Yeah, I mean, money is always good, but you know, it's a long way always, and money is limited, and you can only spend €1 at once and not twice. So I think the first step, and we have good examples where it works. You know, prevention works for HIV with a PrEP that has been implemented. And this was, there's a strong voice for HIV. And I would wish there's a stronger voice, and this is now the beginning with the Lancet Commission by Isel and so on. And Ursula von der Leyen gave this wonderful opening speech for the Lancet Commission, that the liver has better voice and viral hepatitis and sexual transmitted infectious diseases in general in Europe, and that we have a more focus on the prevention, which works. And we know this, yeah? And this is the first step, that we really put this on the same level as HIV. We have PrEP, we have a prophylaxis, a therapy to prevent HIV. Why not just to implement testing to prevent the sequel of hepatitis, that we can early diagnose these patients and to bring it on a really broad level. I think this would be my wish, to put the liver, this dirty organ that is always associated with alcohol. Yeah, that is a dilemma, because everyone thinks about liver diseases. This is an ugly disease. No one wants to talk about this because it's always related to alcohol in our minds, but it's not. Yeah, there's many phases for liver diseases, and one of them is viral hepatitis. And there we need to do something that put on the same level as HIV.
And in terms of delivering that stronger voice, do you think it is a matter of declarations? It is a matter of setting out a political commitment and awareness, or is there something else? Is it about funding platforms to give you that stronger voice, help you? What concretely gives you that voice?
So we need concrete statements also from the top, and this was the first step. Ursula von der Leyen giving this speech, and you have to look at the video from her. I think this was the first important step. We have platforms, we have EASL, we have the national societies. I think everyone is committed, but we need really to have a broader commitment for liver diseases, and especially viral hepatitis, because we can do something. And this is completely missing. No one talks about this. This is now the start and the beginning. Therefore, I'm very happy that we have the screening for hepatitis B and C in the checkup. That's really a big awareness. And I see this already. It's in the news. Everyone talks about this. Suddenly it's there. And if this is the right measure in the end, we don't know. But at least we have it on the news, and it's there, and it's not. We are just talking in our community, always the same. We need this and we need this. But everyone is talking the same stuff for ages now, and we need to the top level, to bring it on the agenda of the politics in the first row, not in the second or third, as usual.
Maria, did you want to come back? I saw you nodding a lot while Marcus was talking.
Yes, I agree with what was here, but also I want to mention that the networking is a good way to learn how other states are dealing with hepatitis and HIV and tuberculosis. And we should be very open to good practices, but we have to learn also from other failures and trials, because in this way we will be more rich and we will know how to avoid them. So networking, not only like correlation between NGOs, but also at the national level between states, and to learn how to make policies, but how to put them in practice is very important also, and how to budget them.
That is an interesting point you make, Maria, just to follow up on that, because as you say, we tend to talk about sharing best practice, and this session is about sharing your best practice, but we don't often talk about sharing failure and sharing what doesn't go right. How do you think, is that, I mean, that's very difficult to get because people don't want to admit if they launch an initiative and it didn't work. What can we do to foster better sharing of failure and learning from failure? Because it is part of the process.
Yes, but in the example that I give before, it's an our project. In 1,000 people, only 50 enter in the treatment, and it can be considered a failure. But also it's a lesson learned from this project, not from only for us as an NGO, but also for the medical system. At the end of the project, we stayed together with the doctors from the gastroenterological section of the hospital, it's an emergency hospital, and we put all these things together, and they accepted that there are wrong things in their system. We accepted that we need to do something more. So it's important also to talk and to share the failures.
Thank you very much. Sandrine, for you, in terms of I thought that was very interesting. I mean, do you share the things that don't work so well as the things that go really well? And in terms of greater support for you, is it, I mean, money is obviously very important, as you've all underlined. But is it about more than money? This issue of political will, of Marcus said earlier, no one's talking about it. Is that what they need to do? Put it on the agenda.
I think one of the other priority is the access to treatment. I don't know if in Europe it's the same for all the country, but in France we have the chance to have assurance, but access to treatment is essential, and testing without treating doesn't make sense.
It's clear.
I think in Europe, obtain a financial agreement between industry and government to make a treatment accessible to all is very important, like it was made for HIV.
I mean, do you feel that until now, hepatitis viral hepatitis has been the sort of poor cousin of HIV in the sense of so much focus on that and remarkable successes as well? Sandrine, how can we make sure? I think it was Marcus said, oh, the liver. It's just not something people focus on. I think you called it the dirty liver, Marcus called it. That really is a crucial element of all of this. How do we? Is it a question of political declarations, of putting this at the center of partnerships, as we heard about between the WHO, Europe and the EU? What's the key, do you think, to that? Sandrine, yes, do you have a thought on that? Is it, I mean, coming back to what Marcus said about a stronger voice, how can we give you a stronger voice? What needs to be done so that people listen and hear what you're saying?
About communication or
yes.
communication. We need to communicate and to educate more health people, health workers, and I think, like Marcus said, generalists they don't know well the pathology, and they hesitate to test and to treat the patient with hepatitis C.
Yeah,
they don't know, and they don't want. So we have patients with hepatitis C, but nobody care. They have never heard about the treatment.
Yeah.
And that's very interesting, because we focus a lot, obviously, on communications when it comes to the general public and to testing, to prevention and so on, but we don't focus so much on healthcare professionals. And if we're going to get a genuinely integrated approach, a multidisciplinary approach, how important they are. Maria, did you want to react to that?
Yes, I want to say that you're right. Hepatitis C, it was a co-infection for HIV for many years. But what we know now is that it's a dynamic. Hepatitis B and C are dynamics epidemic in the community, like drug users or MSM, men who have sex with men. So it's a dynamic epidemic, and we need to act to do something. It's not only HIV co-infection, it's something different, and involve not only infectious disease doctors and hospitals, but also others, family doctors, gastroenterologic doctors. They know to open their mind, and they know to learn more about how to treat them. And also they don't need to have afraid when it's a co-infection with hepatitis, with HIV. So this means that it's a multidisciplinary approach. We need to have not only the infectious disease doctors, but also the others. And the key, I think, it's not what we want. The key is the political will. If the governments and the legislative are aware and they can understand, and the EU put pressure on them and give them recommendation, but also monitor them how they take this recommendation and they put in the practice in their country, that can be solved, I think, and
Absolutely.
I hope.
Absolutely. And a last thought and question to you all, and it links to that political will. Marcus, if we are to do one thing to generate, you talked about having that stronger voice and the importance of everybody, of this moving to the center of policymakers' focus. If we are to engender that political will, what for you do you think is the key next step for people like you? And you've already achieved successes, but there's always more work to be done, and for others to build and generate that political will right across the EU?
Yeah, I mean, it's difficult. Again, talking about HIV, where it really succeeded, were also, in the end, prominent testimonials, which we don't have for hepatitis B and C as well. And that is one step by step. I think if this could, if we could find also prominent testimonials that engage and encourage people to do something for hepatitis B and C, that could help in the end. Sometimes politicians are not enough, and this was a success also for HIV. It's a different community, and this is a dilemma, because viral hepatitis is a disease of migrants, of people that use drugs, that the liver is cirrhotic, then it's associated with alcohol. So this stigma is a real dilemma, and this is, I think, the key to overcome this. And I think this needs to be done first, also at the EU level, to put some awareness on this, to put some voice for this, and this could be maybe to turn this, and to now we want to talk about diseases from the vulnerable groups, from migrants, and so maybe put this as a positive issue, as a key. This is a disease who needs maybe most of our help, because they are not have access to the healthcare system. They need our help, and this is something I think could work, and this could be done on the EU level.
Thank you. Sandrine, a final thought in terms of addressing that stigma and discrimination, which of course also can exist within the health profession. You were talking about educating healthcare professionals. There can be stigma and discrimination there. A final thought from you on that, and from Maria, and then we need to move on. Sandrine.
Yeah, with our project, we have no problem with stigmatization, because we receive the patient in unconventional care. So it's very, very, very important. And they are happy to see her, to see us every month, and they come back, and it's really outside the walls of the hospital. It's really the good thing.
Thank you very much. Maria, a final thought from you on this issue.
It's important. It's an important issue, because these people who are so marginalized and so socially, let's say, not loved by nobody, these immigrants or drug users, and they have a lot of bad behavior. Let's say they have appointments and they don't come. They have different, let's say, not good appearance. They smell and I don't know what. And for that reason, in the hospitals, they are not very well approached. And also, the doctors have afraid that starting a treatment for a person like this will not end it, and he will not be paid at the end for the insurance house. And they have afraid that not be paid for something that they spend time, and also they are responsible. So this means discrimination and inequalities. So we need to do something in our health insurance house to accept and to simplify the entrance in the treatment for these people.
Absolutely. Thank you so much. Thank you, Maria. Thank you, Sandrine and Celine. And thank you, Marcus, for sharing your initiatives, the successes you've had, and so eloquently outlining the challenges that are ahead. We're going to discuss with policymakers in a moment, and others, what the EU can do to help, how those instruments can be used, how the financing can best be used. But thank you to all three of you, and best of luck in your continuing work. Thank you so much. So we are now going to move to our final panel, ladies and gentlemen, on the way forward, EU policy and funding measures to move the needle for 2030 elimination to become a reality. Delighted to welcome our panel. We will be joined very shortly by Dr. Cristian Silviu Busoy, MEP, who's chair of the European Parliament's Industry, Research and Energy Committee and was the rapporteur on the EU for Health programme proposals. He's going to be joining us very shortly, hopefully. Dr. Erika Duffel is with us already, principal expert hepatitis, STI, bloodborne diseases, DPR at the European Centre for Disease Prevention and Control. We have with us George Kalamatsis, a chief co-chair and chair of Liver Patients International, and Greet Henriks from Viral Hepatitis Board in Antwerp, and also a member of the Achieve Coalition. Greet, great to have you with us as well. A very warm welcome to you all. And Erika, perhaps I could come to you in terms of your assessment. We've been hearing from speakers in previous panels about the impact that COVID has had on attempts to reach that 2030 goal. But in terms of how well we were doing before COVID, Were we on track then? It has been a setback. How serious a setback do you think it has been? How would you assess our overall progress?
Thank you, Jackie. Good morning, everybody. So in terms of sort of looking at the progress towards elimination targets, I think it's important to note that the WHO define elimination as a reduction in mortality and a reduction in incidence of new infections. And reaching these targets is around, in order to reach these targets, countries need to scale up different interventions related to prevention and in relation to testing and treatment. And they've set specific targets. Now, we set up a monitoring system. We've already heard a little bit about that already. So we set that up in 2018. We worked collaboratively with WHO and other partner organizations and closely with our colleagues in the member states. And we've conducted 2 data collections now. So we did the first data collection in 2019, and we've just conducted the second data collection now. The collection of the data has been challenging. I think we've already heard a little bit about those challenges already. It is problematic. And one of the issues that came up very strongly from both data collections was the lack of data, lack of robust data, lack of recent data. And this was a real major challenge. And what we saw with this second data collection that, over the summer was that the paucity of the data had deteriorated. So inevitably, we can see the impact of COVID on the data monitoring systems that are in place across the EU. And this is really disappointing. We set up a system, we want to support countries in monitoring progress towards elimination, and we can already see that, there's a setback from the perspective of COVID, because so many of the clinicians and the public health fraternity who were involved with the collection of data were involved directly on the front line with the COVID-19 response. In terms of, I'll dig in a little bit in terms of the data that we've got so far. And what we found was that it focused first on prevention. And the targets around prevention relate to harm reduction, to vaccination, and around blood safety as well. And we can see the situation most favorable in relation to measures that are in place around blood safety, and that's to be expected. We've got well-founded systems within the EU around blood safety. In terms of harm reduction, what we saw is that there's a lack of data, but from the countries that did have data, only 2 countries in the EU had achieved the 2 targets related to harm reduction around clean needles and provision of opioid substitution therapy. And this is really, really disappointing. So there's an urgent need to scale up harm reduction measures. In terms of vaccination, we have well-established systems within the EU, but from the countries that were able to report data, only around half of the countries had achieved the 95% hepatitis B vaccination target. And what we saw with the 2020 data collection is that less countries were able to report the data. And this is something that has been seen across the board for all vaccinations. And actually, we saw a reduction in coverage. And this is really, really worrying. And whether this relates to the direct impact of the pandemic with, people unable to attend appointments because of lockdowns or services temporarily closed, or whether this relates to vaccine hesitancy, we don't know. We will need to monitor this extremely closely to see how things develop over time. In terms of testing and treatment, what we saw was that some countries have done extremely well and have diagnosed a high proportion of cases. But overall, across the region, we have a high burden of disease. We've got millions of people affected with hepatitis. And what we see from the data is that a large proportion of these infections remain undiagnosed. And what we see from the data also is that many cases, when they are diagnosed, they're diagnosed late. So they're presenting already with complications of disease, so hepatocellular carcinoma and with cirrhosis. In terms of treatment,
briefly, if you would now, Erica.
I will. Sorry, I'm nearly finished. In terms of treatment, we can see that what's promising, new acting antivirals are scaled up and available across the region. This is very encouraging. But what we can see, and we can see some countries, some of the countries that have a very big burden have already scaled up treatment, but there are barriers as well. Not all those who are eligible for treatment are receiving the treatment. So overall, we see some encouraging signs. There are some countries that are doing very well, but overall, my assessment is that the data is a major barrier, and we need to address this, and we are addressing this. But from the data that we do have, many countries are far from reaching the elimination targets.
Thank you very much for that very comprehensive picture of where we are and where the challenge lies. And we've been talking about some good practice examples. We've been talking about some of the barriers, that very much underlining where we need to focus the effort. Delighted to welcome Christian Boussaï. Very good to have you with us, sir. Thank you so much for being here. And Christian, we've been talking throughout the morning about how well the EU was doing pre-COVID in terms of meeting that elimination goal, what impact COVID has had, and what remains to be done. And I know you came in just towards the end of Erica's presentation there, but you were saying we're doing well in some areas, on some countries doing well, some less well. Urgent need to scale up on harm reduction, a reduction in vaccination rates, which is worrying, and many people undiagnosed or diagnosed late. So those were just some of the headlines I picked out from what Erica was saying. How would you assess the EU's progress before COVID and the impact that COVID has had?
Good morning.
Good morning.
Well, I believe that we should acknowledge some important progresses made in the past years, of course, before COVID, because it's clear that during COVID, the situation was difficult, and most of the attention of the member states and governments was devoted to COVID-19 management, and this affected a lot the patients, the cancer patients, the hepatitis, by making more difficult their access to medical service, to screening, to early diagnosis, even to treatment in some moments where the restrictions were imposed, where the hospitals were very much overwhelmed by COVID patients. But I should say also that during many years, I have witnessed, and I also tried to see a new agenda, the hepatitis. And if we compare the situation with 10 years ago, 12 years ago, I think the situation improved. And more and more the policymakers from European institutions, but also at the national level, they understood better the burden of hepatitis over the EU citizens, EU healthcare systems, or even European Union economy. Of course, despite our willingness, European Union was not fully prepared. Member states during the years sometimes had other major priorities, and the situation is very unequal, as you mentioned, and it was presented earlier. But I think we experienced good political will. Some of the countries really made the fight against hepatitis and eliminating hepatitis B and C by 2030 a priority. A lot remains to be done. We need a clear EU policy framework to drive forward hepatitis elimination in a comprehensive but also targeted manner. We need to decrease the inequalities. We need to capitalize on synergies. And of course, we need to look more to the risk groups and comorbidities. And of course, we need to take some lessons from COVID-19 pandemic, which should illustrate us the benefits of sustainable investment in health, and specifically communicable disease prevention, early detection, diagnosis and treatment.
Thank you. And you, of course, pushed for equal recognition of communicable and non-communicable diseases in the EU for Health programme, pushed successfully, I might add. Do you feel we can learn lessons? We've talked very briefly, Christian, before I come to Greet and George. Do you feel we can learn lessons from what happened with HIV/AIDS? And we've talked already today about the 2004 declaration, Dublin Declaration, WHO and EU together, which people say gave a real impetus, pushed us in the right direction. Do you think we can do more in that area? We heard from the WHO today that they're working on an integrated action plan. Do we need more partnership and collaboration to really push this issue up the agenda in the way that that did with HIV/AIDS? A thought on that, then I'll come to our other panelists.
I believe we could learn anything from any successful attempt to put higher on the agenda disease or another. Of course, HIV could be a good inspiration for strategies for eliminating hepatitis. Also, maybe even EU beating cancer plan could be also inspirational, because we could be inspired by the way the issue is treated, by the strong political will, by comprehensive approach. Of course, hepatitis, liver diseases is very much interlinked with some of the EU beating cancer plan, as sometimes some hepatitis could lead to cancer, and of course some liver diseases. So there are interlinked, as also there are with the HIV.
Christian, can I just check? I know you can't stay with us for the full time of this discussion. When do you have to leave us?
12:20.
Oh, we have time. Very good. So I have time to come back to you on some of these points.
Yes,
let me bring
please.
in now George and Greet. George, in terms of your assessment of where we are now and the degree to which viral hepatitis is recognized as a public health threat. We've talked a lot about awareness raising, both with the public and with healthcare professionals. How do you see the situation now? And then we'll come on to how EU policies and tools can help.
Well, Jackie, thank you very much for this question. Of course, thank you very much for organizing this meeting. I think I'm really sorry, but I think that the situation with COVID right now, especially the European Union, is not giving many promises for the future. Right now, most of the healthcare systems around the European Union are struggling in order to take care of the flooded ICP units and the continuous rise of cases and the continuous rise of people that are getting infected and of course getting more sick is the number one priority among health politicians.
Yeah.
This is a long-lasting already situation, and I think it will last for a couple of years more. And this is something that affects, of course, all the healthcare system in general. And of course, it affects viral hepatitis, and of course, it will affect the general health of the population. So the pandemic is here, and the pandemic will have a significant impact in the future, not just the direct effects, not the deaths, not the long-last COVID cases, but it will have an indirect effect in the general health of the population. And this is something that we need to take under consideration. People right now, either that they are a vulnerable population or the general public, either they live with a chronic disease or not, all of them are struggling to have access to the healthcare system. And this is something that will affect the health in the future. So in the ways that I have, in my view, of course, I think that the situation right now, it is in a certain very important point that we need to take under consideration.
Absolutely. Thank you, George. So the key is how can those policies help? Want to come back on that, but Greet, complete the picture for us in terms of where we are now, and whether you believe there is a great enough perception, understanding of the importance of hepatitis as a threat to public health. We seem to have a sound issue, Greet, but you don't seem to be muted, so I'm not sure what is
I can try it like that.
Here we are. Yes, I can hear you now.
Okay.
Thank you.
So I want to add on what Erika and George were saying. Especially, I want to also support the request for more data. So when we are organizing with the VHPB meetings in the country, like we normally do when there is no COVID, we are going to the countries and discuss the way how they could tackle the elimination goals in their country. And in almost all meetings that we went, there is an issue on data collecting, to have data, to have an overview. You can go for elimination, but if you don't know how many what your burden of disease is, I don't know if you can make a real plan to go for elimination. So, and then coming to the point of what George is saying about the COVID, I think also Christian mentioned already that you have to look to the synergies. There are a lot of synergies in the COVID, in tackling the COVID pandemic at the moment that we can use for hepatitis. So I'm thinking, for instance, now a lot of countries, they can report with the COVID Safe Pass, they can report the vaccination on a good way. So they can look to their vaccine coverage rates, and they can reporting that data now, so it would be more easily to see when there is need for interventions to improve vaccination. Especially we see now that there is a spillover of the vaccine hesitancy that is growing in the COVID vaccine, that there will be a spillover to the normal, what we then call child routine vaccination. So it is easy when you have this registration options that you can react more fastly than was previously ongoing. And what I also would like to say is, and then more in view of screening, that the use of self-test is now also something that is very promoted in a lot of European countries, and that seems to be acceptable by the public in general. So also on this wave, we can go for more screening and more elimination. And the last part I want to mention is that maybe now healthcare providers are asking a lot of information on COVID vaccines and on all these things. So training of healthcare providers and giving information to healthcare providers, this is also a synergy that we can use from the COVID.
Thank you. Lots to come back to. And an interesting point you're making there, because we've been talking about the challenges of COVID, but also the opportunities. Another challenge you're adding, potential vaccine hesitancy, but another opportunity, greater use of self-testing. Erika, let me just come back. Let's start to talk about those tools and those instruments, because we don't have much time. On the role of your organization, of the ECDC, you've had your mandate extended, agreement on regulation yesterday. What difference could it make, particularly I'm thinking in this area of data collection? You've talked about it, everybody today has talked about how this is one of the big issues we have to tackle. How do you see, what impact do you think the extension of your mandate could have?
That's a good question, Jackie. So the COVID-19 pandemic really, I mean, it exposed the weaknesses in communicable disease control and surveillance systems around the world, really. And the extension of the ECDC mandate is in response to that. And I mean, it's early days, but the push with this mandate is to give a stronger role to ECDC around the prevention and control of communicable disease threats and improving preparedness. And this is going to be just around, stronger coordination, production, continued production of sort of risk assessments, collection of more robust data, assessing emerging evidence, and sort of the whole preparedness planning. What this means for hepatitis specifically is really not very clear at this particular point in time, but inevitably all of those areas, particularly the strengthening of data collections, will have a knock-on effect for hepatitis. So it is only going to be positive. But I mean, I think the critical point, though, whatever the impact of this change in mandate, which obviously will take form and shape in the sort of months and years to come, you know, the support to member states in achieving and monitoring progress towards the SDGs is very clearly outlined in the ECDC strategy. So irrespective of whatever this new mandate holds for us, we're already committed to supporting countries, to monitoring progress, to developing the information systems, and we are doing that. We have a very strong focused program that we've developed over many, many years to try and fill these data gaps, to try and support countries as best we can. So this happening, and I'm only hopeful that, you know, we very much welcome this change in mandate. We do need additional resources at ECDC. We've really struggled with this pandemic. It's been an enormous challenge for us.
And I know
so
you're also very
welcome
busy
this.
dealing with that as well, Erica. So we're so grateful you're with us. Christian, that point you said earlier, we need a clear EU policy. And Erica was saying there, she's outlining what's happening in her area. She's not clear what it means for hepatitis yet, but important moves forward. We talked a little bit, we've mentioned the EU for Health programme. John Ryan also mentioned the pharma strategy earlier. How can these EU tools and instruments best be used to deliver that clear policy? And I'm also thinking, people have mentioned the Beating Cancer Plan, the importance of hepatitis as a risk factor for cancer, whether we need something more specific in there as well to address hepatitis. How do you see the way forward in using all these policies and instruments most effectively?
At the EU level, of course, we could envisage much more actions. I'm not sure what would be the right strategy. Of course, we should continue to raise awareness, to make policymakers understand the burden of hepatitis and the fact that we could really, it's very feasible to eliminate hepatitis by 2030 because we have the necessary tools. We just need to devote more attention, more investment, and more political will in order to implement all these strategies. But I believe the most important aspect is related to the member states' actions, like it will be in the EU Beating Cancer Plan. Of course, it is good that we have this initiative at the EU level. I was also among the promoters. I recognize and I fully support it in EU for Health, the idea on concentrate on cancer, as I put a special focus on HIV, TB, and hepatitis B and C to be clearly recognized as priorities for this health program of European Union, which is better funded, even that 40% of them of it will go to HERA to better prepare for the future and for crisis preparedness. But still, we speak about an important amount of funding which will can be used for the best strategies, best exchange of good practices, and of course, even concrete actions in the member states. But as it is the case for, it will be the case for cancer, and you'll see in the future also for hepatitis, the most important role will be played by the member states. And here we have to know exactly where we have the most problems and where the situation is not really a priority, and to try to push there with the support of European Parliament, with the support of European Commission, we try to mobilize the European institutions to try to put positive pressure and to convince those member states where the action is not very clear to act faster and with more determination.
Thank you very much. Greet, you enumerated a number of key challenges in answer to my first question. How do you see the role of the European Union? Christian saying many of these issues, of course, need to be addressed at member state level and even at regional level. But how do you see the role of the European Union? Where can it most help to support efforts to tackle these gaps and challenges?
I think they can, especially on the what we call the synergies, that they like what I mentioned is the training of the healthcare workers that could be done on a European level. It could be also in the beating cancer plan, you have a lot of attention that at the moment is going for HPV. So there also could be more a link to other communicable diseases like hepatitis. So if people set up also there, they want to go for elimination, and I see the same struggle that they have for HPV as for hepatitis. So maybe they can there share these best practices and learn from each other and make policymakers aware that when they think in one direction of a disease, that there are other diseases that can fit in their plan, to make a general plan, like for screening, like for prevention, that they look to use the money more efficiently in all these plans that they are tackling at the moment.
That's very interesting, Greet, because we heard in the last session about Germany, where testing has become part of the health checkup 35. So, but it took a lot of work to convince people that this should be included. So for you, that's the key to really looking everywhere to say, where should this issue, where should hepatitis feature more strongly in general plans?
Yeah, until now it was always that we were looking for all the HIV plans, but I think you can go more broadly to prevention plans and in general, and also people who are reporting data on hepatitis, on HIV, or on other communicable diseases. I think there it could be also looking to these synergies. What can be done to have more data collected, to have more data reported on a decent way? So I think best practices, but then more on the local level that can be shared on the European level and forced on a European level to do so.
And George, you painted a bleak picture for us at the beginning of how you fear the situation is and is going. In terms of the role of the EU policies and funding, Christian said we're talking about an important amount of funding, and he pushed very hard for hepatitis to take its place and its share of that funding. Is money the key, or is it something else? What's most important for you?
Of course, money is always an issue, because there is a huge need of investment, especially in the public health area in every healthcare system. But apart from that, as we heard from the previous speakers, we need also strong policies, strong policies and politicians that are there to implement them. What was not so very promising is that we heard from Erika before, from the report from the CTC, that there is only 2 countries that have actually managed to
on harm reduction. Yeah,
on harm reduction. Yes. This is sad. I mean, this is something that has nothing to do with budgets. Harm reduction measures are extremely the most cost-effective measures that we can find right here, right now. And it is very sad that only 2 of the countries have implemented them and reached the goal. So, yes, of course, in order to wrap up, money is extremely important, but we need strong politicians. And something that is very important, and I think it has not been in our attention. When we're talking about viral hepatitis, we're talking about disease that has 25 years of ending to cirrhosis and maybe to liver cancer. Right now, if we do the math, most of the patients got infected 20, 25 years, 30 years before. It's the time that this pandemic will show the devastating consequences in large populations. If we do not do something now, this will affect the budgets and the health of the individuals in the European Union.
Thank you very much. Christian, I know you have to leave us shortly, but I want to ask one question on an issue we haven't tackled in this panel, and then ask you for your key next step. Inequalities, because we've talked a lot about the member states where it's going well, where things have been done, and Erica was enumerating that there are countries that are doing great. There are many other countries that are not. In terms of addressing inequalities, in terms of access to information, treatment, care, where what do you think the EU can best do to help? And before you leave us, your key priority, your key next step to build on all the work you've been doing as a policymaker for EU action to develop that clear policy that you were calling for. But first on inequalities.
I believe that on inequalities, first of all, we have to clearly assess the situation. And of course, here the feedback provided by patient associations, by industry, by different stakeholders, which have experience and have the data from each member states will be important. So we should assess the situation, and this assessment should be accepted by European Commission. First, of course, all institutions should be involved. And then we should convince European Commission to start talking and sending signals to those member states where the inequalities with the European middle, let's say, are higher, to start to act. What I previously said, we need to concentrate on those countries, because the inequalities, of course, could come from objective reasons, and it's clear that it's not the same level of investment, the same budget, the same possibility to treat in the same way. But even there could be improved, or could come from non-action and not making from hepatitis C and B elimination a priority. And here we should act, and we should put pressure. But of course, first we have to assess the situation. The next step will be to again make a clear plan, a clear European and national plan, in order to achieve or to be as close as possible to the target in 2030. And of course, a comprehensive document, a comprehensive strategy with the most important key actions and where we should concentrate, with some recommendation for each member state, could be extremely helpful, and then disseminated and making aware the key policymakers on this.
Thank you so much, Christian, and thank you for your time today. We are very grateful to you for joining us for this discussion. Same question, and I'm going to go to Erica, then to greet and give George the last word and for some closing thoughts as well. Erica, in terms of a priority for action, a key next step to address all the issues we've been talking about, where would you put the focus?
That's a good question. I mean, I think that we, as a region, we have many instruments now to hand. I think, we've heard a lot of them discussed today. So the cancer plan, the EU for Health programme, many other different sort of opportunities and strategies that are at our fingertips. And these also, we've got a strong foundation of these across the EU as well. I mean, there've been many previous health projects and programs, joint actions. So that, we've got a wealth of all of these resources. I think that we need to be better at, I think John Ryan said this right at the start. I think we need to be better at transposing these at the sort of national level, making sure that, these actually have an impact. And I think to do this, we need to be working, there's a good connection. I think one of the very good things about the European region is that we have a very engaged network of stakeholders. We work very well together, but I think we could work better together to get closer to the countries, to understand their needs, to make sure that these resources are taken to where they are most needed. And I think this sort of working more closely with the countries is something that we're going to be doing more of at ECDC. It's in our new mandate. I very much welcome this. I think this is certainly the way that we all need to go. We need to get closer. It's great to have these tools at the EU level, but the action, and where it's needed, it's down at the ground. So
thank you very much, Nerika. I know how very busy you've been dealing with the challenges of the Omicron variant, so we are immensely grateful to you for spending this time with us today and sharing your insights and thoughts.
Jackie.
Really, really grateful. Thank you. Greet, for you, the key priority, the key next step at European Union level of all the issues that you raised.
So as we are from the Viral Hepatitis Prevention Board and we exist almost 29 years, we put a lot of attention in prevention, in vaccination and vaccination for hepatitis B. And there the key priority is don't lose what we already have done in all these years. So if we now see that there is an increasing on vaccine hesitancy, and that is there may be a spillover on the routine vaccination, I would like to really emphasize that don't let it be happen. So look already from the beginning and see if you can take actions to at least save the high coverage rates that is already in a lot of countries. Because 5 years ago, there was a lot of enthusiasm on treatment and a lot of attention, a lot of money went to treatment to really control the disease. But then they start to forget that prevention was also a low-hanging fruit, in fact, to go for elimination of hepatitis. And there I would like to emphasize again, please keep this prevention and especially vaccination into attention on the European level, on the member states level, on all levels, in fact. And what I would also like to emphasize is when you see the difference that are done in hepatitis, we have a very strong civil society, a very strong patient organizations, and I think it's important that they hear their voice in elimination, also on European level, also on member states level, because they really can move something. They can have some actions done that previously were not done. I see it now when you see the elimination of HPV.
Yeah.
There they don't have this strong civil society, and this is really an added value that should be used in the future also.
Thank you so much, Greet. George, your final thought on where we need to go from here in terms of priority for action, key next step, and perhaps some reflections as you're hosting today's event on the discussion we've had, the work of the Achieve Coalition and the way ahead.
Well, thank you, Jackie. For where we need to go after here, I think we need to wrap up all our powers that we have. We just mentioned that we have a very strong civil society, extremely good treatments, and extremely effective vaccines. And I think we need to extremely also powerful civil society clinicians, and a bunch of politicians that are supporting us. And we need to wrap up our powers all together and try to put again a viral hepatitis up in the agenda. Regarding today's meeting, on behalf of the Achieve Coalition, I would like to thank all the speakers and the audience who have contributed to our webinar, Setting Course for Hepatitis Elimination, What the EU Can Do to Help Reach WHO 2030 Goal. I hope that this event was demonstrated that there is much that can be done. We are not powerless in the fight against viral hepatitis. We know what to do. We know how to better inform, improve diagnosis, regardless of the risk profile, and ensure the linkage to and coverage of care, while also fighting stigma and discrimination. There are several good initiatives at the EU level that can be used as a springboard for progress, notably the rollout of Europe's Beating Cancer Plan and its initiatives to improve cancer prevention. These should include measures to eliminate viral hepatitis B and C, and thus reduce the cancer burden through better information on transmission risk, diagnosis, and linkage to care. This must also include greater efforts to overcome the vaccination hesitancy of hepatitis B. In addition, the mandate extension of the ECDC will support better generation of data on hepatitis so we can ensure target guidance. As we know and have heard also again today, there are good initiatives out there at local and even national level with or without government support. What is, however, also true is that these initiatives are frequently disjoint and lack momentum. There is where the EU could come into support. We need continued and increased EU4Health funding to ensure the exchange of good practices between stakeholders across the EU, so we can all learn from each other and continuously check in on progress made. We also need structures in place to ensure that all member states' governments can continue to exchange on good practices and ideally also include those governments in the neighborhood. This is why the extension of the steering group of health promotion, disease prevention and management of non-communicable disease in the context of the United Nations SDGs is so important. Finally, as Luis Mendoza alluded to it in the beginning, there are very successful cooperations between WHO Europe and the EU in the fight against HIV/AIDS, which began with the adoption of the Dublin Declaration in 2004, and which shaped the fight against this disease at the local, regional, and national level, resulting in various good programs and initiatives which included governments and key stakeholders. A similar signal from the WHO and the EU to mark the final run-up of the 2030 elimination finishing line will be important. Failure to meet the WHO 2030 targets is not an option. We have all the necessary means to make elimination a reality. We have an effective vaccine and treatments to tackle hepatitis B, as well as a cure for hepatitis C. We also know how to diagnose and how to approach the different risk groups. We owe a concreted efforts across Europe to all those who are out there, to those who do not know they are chronically infected and those who do not know how to take precautions and protect themselves. This is now an important time to address this together. I would like to express my sincere thanks to the participants once again, and of course to our moderator, Jackie Davis, for leading the discussion so brilliantly for one more time. I wish you all a wonderful day.
Thank you very much indeed, George. And it only remains for me to add my thanks to all our speakers today for great, insightful discussions, very clear identification of some of the ways forward, what needs to be done to address this vitally important issue. Thank you all for joining us today. I wish you a pleasant rest of the day and do stay safe. Goodbye.